have Dr. Fahmy from Boca Hospital. So he's a chief information officer. So it's pretty nice that he's here. He's an excellent guy.
Yeah, thank you for hosting that. I actually transitioned to chief medical officer starting in March, but
oh, wonderful.
Still hold both departments.
Congratulations, Dr. Fahmy.
Okay, I think we can get started, and there'll probably be a few more people joining us as we move along. So good evening, and welcome to the Palm Beach County Medical Society Town Hall on Caring for Physician and Healthcare Workers During Crisis. I'm Dr. Brent Schillinger, member of the Medical Society's COVID-19 Response Task Force, which brings you a great deal of important information in these unprecedented times. We continue to do that this evening with a conversation on physician burnout and other mental health issues, specifically in the time of COVID. Joining us for this important focus is Dr. Shawn Baca and Dr. Abbey Strauss. Shawn's a rheumatologist and Boca Raton. He's past president of the Palm Beach County Medical Society, chairs the Physician Wellness Program. Abbey is a psychiatrist, past president of the Florida Psychiatric Society, and coordinator of the Medical Society's podcast series. So this is a very, very timely topic. Here we are 6 months into the pandemic here in the United States. If you look at the cover of Medical Economics, just this week came out the September issue, it's focusing on physician burnout and the COVID-19 toll. Wherever you look, there's a lot of commentary on this particular topic. So tonight, we want to talk about how to cope and manage the emotional impact, specifically focusing on physicians and other healthcare personnel. We want to talk about how to cope and manage emotional impacts. We want to get personal. We'd like for people to share your personal experiences as healthcare professionals. Important not to assume that you're the only one who thinks they're burned out. So let's get into some questions, get into the discussion. Shawn, first, what have you been feeling since the onset of COVID, professionally and personally? Any burning out on your own part?
Well, you know, the thing is that, I mean, I think we all feel a little burnt in terms of schedules and things like that. It's difficult to you know, deal with stuff on a normal basis, but, you know, when day to day, you're not sure if your staff is coming in or not. You're trying to do telehealth, which is difficult. I mean, I know people like it, but for my particular specialty, it's difficult because you really have to do a physical exam. Like dermatology, I think would be pretty tough not to be able to look at something.
And hard to
you know, patients often hold their phone to their ear, you know, so you just, you know, you have that. And then the financial, I think, is really kind of what's getting to a lot of people. We're pretty fortunate that we've been able to keep our boat afloat, but you know, what we did is we stopped paying ourselves for a couple months there so we could keep our staff fully employed. We were able to get the PPP money, so, you know, that was very helpful. But, you know, I don't particularly feel very burnt out right now, but because I feel very lucky. You know, one thing that, you know, volunteering has really helped me to do is that I think that really has kind of helped, you know, in terms of my burnout issues, is that, you know, if you feel like you're active in doing something about things that, you know, we're unhappy about, you know, you feel better if you're an active participant than a passive one. You know, stress comes in lots of different forms. You know, you have the financial stress, and then of course you have the emotional stress, and even the physical stress of doing this. But, you know, because some people are taking extra shifts and doing other things to get through with it. But, you know, one of the concepts of physician wellness is that, you know, we have a crisis in this country, and you have physician suicide at an all-time high, especially female physicians are more than 2 times likely to kill themselves than someone in the rural population. And males are 1.5 times. And kind of the concept comes through is the concept of what we call moral injury. And the idea basically is that, you know, we're putting a kind of a no-win scenario situation. And a good example is that, you know, I may need to see somebody who has bad arthritis, and I need to order these very expensive medications, and I've got things at home to do, or I got a kid and I got to go see the recital or something. So do I, put myself in harm's way by saying, okay, I'm going to fill all these forms and everything else. I'm going to miss my kid's recital. My kid's going to hate me and my wife's going to hate me. Or do I, not fill out the forms, not order the drug, and just try to get by with something that's not as good to kind of keep the insurance happy, help happy. And then you create this, scenario where you're self-loathing, because you feel like you didn't sign up for this. You signed up just to do the best job you can, and you find that yourself in the situation you got. Same thing with, people having stress with the COVID as far as, finding adequate PPE, and those kinds of things.
So a lot of issues on the table.
Yeah.
Abby,
So Abbey, what do you think about?
I'm going to ask Abbey the same question. What have you been feeling? It's only fair.
No, that's fair.
Since the onset of COVID, both on a professional and a personal basis. Here we are giving the advice, but we'd like to hear from the experts what you've been going through.
It's been hard. It's been, shall we say, educational. I did not expect to have the continuing issues that I'm continuing to have, because it just doesn't stop. And I've begun to formulate it in my mind that, and it's both personally and professionally. To go back to what Shawn said, to sort of bounce around and pull it together. My practice is down, and the money is, we're okay, but there's not the wiggle room that there was, and things are much tighter, and I worry about where things are going to go in the future, and just being able to give my secretary a good Christmas gift and be able to pay the increase in the insurance premiums and all those types of things. So the business manner it's very much there. But I find myself deeply fatigued because I don't see an end to it. And when patients call me up and we speak, they want an end, they want a resolution. And I joke frequently with people, but it would, when someone comes in and says they're having marital discord because somebody is not being loyal to them, it's like, wow, that's a real problem that maybe I can fix. I can't take away the coronavirus. I can't remove that. And I can't tell you that realistically it's going to be fixed in January or whenever. And this hangs on people's heads. And many of the people that I've personally dealt with, some of them, if they have something to do, they're better. If they have a focus, and I say volunteer, read a book, take a course, do anything, get a job if you can, if that's possible. But many of them can't, or they're so frightened, and it's fatiguing because sometimes I feel patient after patient. Again, that's not, I have to keep it in perspective. A lot of patients, like I'm doing the same thing all day long. A pep talk. We'll do it. We'll get through this. Don't worry. And I don't want to give medications for their anxieties. I'd rather them develop some sort of psychological strength. Many of them don't have it. And that's a real problem. The other thing that I'm finding is that many people don't know how to entertain themselves. They don't know how to take care of themselves. And I think a lot of professionals too, because they keep themselves so busy doing other things. Historically, their entertainment was going shopping or going to the mall or whatever, and they're not doing it now because they can't. And so there's an absence. And I think people are losing the purpose that they had in their lives. And it's exhausting to try to get people to find a new purpose in their life. And it just doesn't stop. I will also say, and I don't want this to become a political thing, but part of the problem that I'm bumping up is that the coronavirus issue has become a political virus issue. And oh my goodness, I can't compete with people who are afraid to go out because they see people on television not wearing masks. So I'm trying to help them be a little bit more prudent and careful, but get out of the house and do things. I have people who haven't been out of their apartments in months because of the fear. So I'm seeing this, it's exhausting from my end. And it's also personally exhausting because, as we've discussed in prior webinars here, we too, all of us, are living under the same umbrella.
So the point being that as medical professionals, we're certainly not immune from the same things that our patients are going through.
Absolutely.
You know,
And we need to find other ways to fulfill ourselves, find a purpose, do something, because a lot of our colleagues, they're good doctors. They love their work, but they don't have a lot outside of their work.
So I would think one of the first steps is just being able to share this with our colleagues, which is why it's so great to have people here on the town hall tonight. And we may be somewhat preaching to the choir, and some of the people who may watch this remotely when we have it up on the website might be at the second level, but certainly there's a lot that comes from being able to share what we're all going through, so that we're not, as medical professionals, as physicians, suffering in silence. Now, Shawn, you've been active for some time now with the Physician Wellness Program. Give us a little bit history behind that program.
Okay, so we started the program in 2016, and that was spurred by those reports that showed the burnout rates in the United States were close to 70%. And I would say probably everybody here has felt burnout in some way or another. And burnout is interesting because it manifests itself in so many different ways. You could have, healthy, approaches to stress, or you could have unhealthy approaches to stress. The unhealthy ones could be, drinking and driving fast and marital discord and, all kinds of other stuff. And, so, we try to put a positive spin on it and, have people working on, more positive things, exercise. And again, for me, I think volunteering has really helped me quite a bit because, the shifting sands we all know about. And, because, I've been at the FMA and now I'm working with the AMA delegation also, I kind of see things a little bit further away because they're not such a secret, because I see, what bills are being passed and things like that. So I feel like it helps me kind of adjust to the future because I kind of see things, a little bit, sooner than other people know that these things are coming down the road.
So back to the Physician Wellness Program.
Right. So as far as
how exactly that works.
Yeah. So the program basically has multiple layers to it. So we have a library that's online and anybody can access it. Just go to PBCMS.org. And there are a lot of articles on burnout, and you'll see very similar themes. It talks about moral injury, what we talked about before, and then it talks about stressors and things like that. And ultimately, the goal of the wellness is really to get, both employers and especially government insurance folks to understand that, what they're doing is creating problems. Because if you have somebody who's burning out and they're quitting or they're this and that, it costs an institution a lot of money to replace somebody. And there's some institutions that are definitely much better than others in terms of how they treat their physicians. The second aspect is that we have counseling. And so if you're a member of PBCMS, we offer 6 completely anonymous counseling sessions. And you can go on the line, you can see everybody's profile, you can get their phone number and call up yourself. And this is completely anonymous, it's self-referred. Now, the reason that this is occurring is because every hospital and every institution has some form of referral system. But the reality is that people who have problems are very unlikely to tell their employer, I have a problem and I need the hotline number, for the stress guy, because then they're potentially worried that they're going to put their job at risk. What we found is that we had probably over 200 calls, and we had, several people, go through the program. The majority were medical students and residents, interestingly enough. And so, we asked what the medical school is doing. They have a formal program, but they send them to the college. And so, we felt that people going to the college are probably not going to be sympathetic to a medical student when they say, oh, you're a medical student, you're going to be okay. And so they're dealing with, the counselor is also dealing with the kid who's worried about, not getting an F in their basket weaving class. So, so there's some kind of, disconnect in terms of what people consider wellness, or, you know, they're going to offer them yoga or whatever else. So we're not a yoga granola kind of group, you know, so, but we do want to talk people off the ledge, you know, the edge if they're really having issues and help them resolve stuff. And the other thing that the society has done, especially with COVID, and the task force has been amazing, is they have resources online that tell you everything where to get the PPE. You know, the AMA has now PPV available for people. You know, you call the particular numbers. You know, how do I get my loans? How do I forgive my loans? You know, I mean, a lot of these things are online and very helpful for people to try to run their own business. So we're trying to provide as much support as we can.
Yeah, the program certainly, in terms of the counseling, offers a tremendous resource for physicians. And as you stressed, it's totally anonymous. So it's confidential and there's nothing to worry about in terms of people finding out.
And
Having these problems. So Abbey, I was going to ask you, you know, there's a lot of other, we've talked about this before, these self-help online programs. Is there any value to that, do you think, for people?
well, some of them are probably
talk about the stress.
some of them are probably okay. We can't vet them all because we don't know them, and we don't know the quality or the skills, or if there is an entrepreneurial spin to it at the other end that will give you the first session free or it's reduced, and then all of a sudden it's turns an entirely different relationship. One of the things that, and as Shawn was talking about, is that those 6 sessions, if they do nothing more than make the doctor feel that he's not alone, that's huge. Because doctors do not comfortably, and there are many others of our society as well, but doctors do not comfortably admit to their emotions. And that's why we have 300 or 400 suicides a year that we know of, that we're calling suicides. We don't know how many passive deaths or other things are occurring. So to reach out to someone who is unvetted, it's potluck. We don't know. They used to be on the internet all over the place. They've disappeared, or at least to what I've seen. And so if someone again is having stresses or doesn't know how to handle it or feeling beside themselves, or their wife is saying to them, darling, you got to do something about this. You got to stop. Or you're drinking more, or you're not sleeping well, or you're yelling at the kids, or whatever, then take the first step of talking to someone and maybe starting to resolve it. The other thing that what Shawn talked about, and I must confess also that I've begun to realize, and with Brent, with Dr. Schillinger, is that doing all these webinars has given me something to focus on. And so I have something to think about. And people, because the opportunity to do a lot of things the way I wanted to do in life on my schedule has disappeared.
So we know that burnout has certainly been at crisis level for a long time. Now, some of the latest surveys, Medical Economics, Medscape did one, shows that in excess of 70% of physicians say they feel burnout now and don't know exactly how to deal with the stress. Why don't we talk for a few minutes about what some of the specific signs of burnout might be? And have you felt any of these?
I have. My family is noted. They'll say that I'm testier, or I'm not as tolerant about things, and I need to take time to rest. I need to take time to watch movies. I need to step away from the pace of what I was doing, and it began to be a problem to me. I felt as if I didn't have the emotional wherewithal to sit and listen to patients say the same thing over and over and over. I can't stand the virus. I'm worried about the political issues or whatever it was, because I could do nothing about it other than be a cheerleader and say, we'll get through it, we'll get through it, we'll get through it, as opposed to dealing with more specific problems that I could attend. That started to burn me out. I had to rethink my approach, and I had to look into philosophy and some aspects of religious things that are meaningful for me. Other people have to find what works for them, to become more supportive of people, and maybe not necessarily therapeutic, maybe more the life coach than the intrapsychic stuff that I really love, that I prefer to do. So I burned out. And one of the symptoms was my irritability. And my family noted it. Oh, no question. They just laid it right on the table.
Sometimes we don't notice it in ourselves, so it's important to
Absolutely.
listen to those who care about it. What about you, Shawn? What are you, either things you've gone through or just signs in general that through physician wellness that we know we need to be looking for that would reflect on burnout?
Well, I think that all those things are, but you have to recognize it in yourself. And I know that, we've all felt this way. And I probably, as I'm older, I feel like I'm a little more resilient to burnout. I felt that way probably more in my 40s. I've been in practice because I started early. I mean, I wasn't practicing by 32. And, so I was 10 years into it, things started feeling a little more routine. You get a little bored and this and that. And when you really realize is that, it's just a manifestation of that. And again, that's why you have to find other stuff to do. I mean, my normal stressors right now is that, it's kind of self-imposed because I'm doing my internal medicine research. And I do internal medicine and I do rheumatology because I'm a double glutton. And so it's a lot of time. It's rewarding in the fact that you're doing stuff, but it's really taking a lot of extra time away from the little time that you have. So you do feel a little resentful, and you get angry with that kind of stuff because some of this you feel like you're just doing busy work, But I'm lucky in my specialty is that patients for a very long time. And so to a certain extent, going to the office is kind of like going to family, and I'm very lucky that I have, employees in my office that have been there really longer than I have, and I've been there almost 30 years. So, so it's like going to family and even patients. So, sometimes you get a little bit of energy from their successes, if they're in less pain, they're doing okay, they're functioning, they survive this terrible illness. I mean, sometimes, that gives me a little bit of extra strength and encouragement, to work. But, sometimes you're in the middle of it, you forget all the cool things that you do.
So back to some of the specific things that as physicians and healthcare workers, we need to be objectively looking in ourselves to say, gee, I think I'm beginning to go over the edge.
One thing that has been identified to me, again, by my secretary, is that like almost every physician I know, the nefarious presence of prior authorizations. And I used to yell, and I would get upset, and I would get vitriolic, and I would do all these things while I was doing the prior authorization because the patient needed it. I know it. So my response does not negate my having to do what I have to do for them. But now when I see it, it's more intense. And I have less patience to do it. And I don't want to write any more letters to Humana. I can't do it anymore. But I'll do it. But my secretary she'll say to me, I'll do it. Just don't, leave it alone. That's a manifestation, one of the things about my irritability. And it was also because I became so frustrated in not being able to do what I want to do for my patients. It became keener for me. And that's how it manifested. I'm sure it manifests itself symbolically in a similar manner, but in specifics differently for different people. I mean, Shawn, you work in a world where, well, I've heard, Brent, you've talked about it too, someone needs a cream. And it's crazy expensive. And it takes you more time to get them the cream than it does to diagnose the need for the cream. And we need relief.
Well, I'll tell you, there's a program online called AMA Steps Forward, and they deal with some of these things, these logistical things, and some of the things that are created by EHRs. And whenever you can delegate outside of your box, you do so. Like, for example, I have some good people in the office, and I say this person needs this particular biologic. I'll put a few things in my note and say they can't have this, they can't have that, and I will hand it off to them. And I mean, unfortunately, I get frustrated because some girls are just not good about doing that. But I have a couple people in the office who are really good about doing that. So if your secretary has, a few templates and she's good at word crafting, she might be able to flesh out everything for you, and you just give her a few facts and then you sign the note and then you're done. The EMR is frustration. And I'm an early adopter. We've been on electronic records since 1993, but when we first used it as a word processor, and it served a purpose. But then, you know, you get the alarm fatigue and everything. You're going to do this, you're going to kill your patient. It's like, we've been doing this for 50 years. I don't think he's going to die if we give these two medicines together. You know, is things like pre-rounding. You know, you look at your charts, you know, electronically, you know, prior to coming to the office or in the morning, and just look and see what's going on, because then you know, oh, this person needs this drug, this person needs a refill, this person, you need to check this. So in case that EMR is down, you know, you can still function, you know, because you have an idea of what you're doing before you walk in the office, because a lot of stuff you can kind of pre-plan. And so there are a lot of things like that that are in there. Same thing with refills. They say, look, always do a 90-day if you can. Only do refills up until the time of the next visit, so that when their next visit comes up, you know, if they need a refill, it's because they need a visit, number one. And number two is that you're not doing it multiple times, you know, in between visits, so you reduce your workload. So the little tricks like that can be helpful.
So I think we've established that things like irritability, inability to concentrate, to work on things that previously we would tolerate, we're not tolerating anymore. And focusing a little more on some suggestions, some additional suggestions in general, how physicians can keep themselves stable through this. You know, I've heard a lot, the number one thing that we hear everywhere is exercise. Where does that fit in to your recommendations?
I should do more than I do. And there are times when I am annoyed at myself because I come home and I'm too tired. But when I convince myself to walk, be it 5 minutes, 10 minutes, 20 minutes, whatever, I'm better. And that makes me just, you know, a human being as well as a physician, because I need to follow up my own prescriptions. And it gets back to what you said, Brent. This is different because we are as much impacted by the same ailment, the same malaise, as is our patients. And we need to rise above that, and sometimes that's exhausting. But exercise is one of the things that makes a huge difference. I tell people, go outside, take a walk, get the sun on your face, feel the wind, walk where it's safe, be prudent, but you've got to do that. And they, you know, a lot of people, when I tell them that I do that, it gives them a bit of a more nudge to do it themselves. As a doc, I can't stand it, give me a pill. No, the pill is in your own activity.
And it's advice that we need to take more of ourselves, as you look
yes, and I concede that I fall in and out of that, I'm sure, like most people do.
The other thing that both of you have referenced a few times already, which I think we should emphasize, is the importance of establishing a routine.
Yes, I exercise a fair amount, and what I try to do is on certain days, you know, I say in the morning I'm getting up a little early and I'm doing that. Now we have a gym where we live, we can't go there, so I found some videos and stuff that I can do and do my cardio in my office, at least, you know, on those 3 days. But it makes a difference. You feel stronger. You know, I always tell patients that your brain is an organ just like your spleen, and you have to exercise it. You know, it's not just about, sleeping. It's also about getting blood flow through it and everything else. And it really does make you feel better. And I feel like I definitely fire a lot quicker, you know, in terms of solving problems and stuff when I do that. So
beyond just exercise routine, how about routine in general? That if you're not as busy as you used to be, or you have a lot of extra time on your hands, you don't want to be just sitting around.
Yeah, I never have time on my hands, so I always have a routine.
So that's a
what I do for myself, and I tell patients, is that this is a grand opportunity to learn something that you know nothing about. Now, that doesn't apply to everybody, and not everybody is capable of doing that. And I'll say that go online, go to Stanford University or Harvard or any of these schools. They offer their courses for free, most of them. You only pay for them if you want the credits. And then pretend like you're in school. That's the routine. You have to watch the class every day at 3 p.m., something like that. And it structures their day. And it makes them have something to do. And that's because so many of the people that I speak to sit around and do nothing too much of the time. And that's horrible. So I agree, the exercise is great. If they could take a course in the afternoon and walk around the swimming pool a couple times in the morning, that would be awesome. We need to follow that as well. I do that with myself. I try very hard every day to watch something, listen to something that's different, something that structured me. And it's like my time all by myself for a half hour or whatever, the routine. It makes a huge difference. I agree with you.
So can we open this up to the audience? So
We are open up to any questions, any comments, anyone who would like to share a situation they've been in or any questions they have who are looking for some guidance. At any point, you can come through on the chat, or you can just
unmute your mic. We don't have that many people.
We can unmute all the mics, anyone who wants to be part of that. And before we get into that, I want to mention something that has come up repeatedly in things that I have read is there's a subset of physicians who actually feel an exaggerated sense of guilt. Like maybe they're just not doing enough through this pandemic. And I want to play a short clip. It's about 5-6 minutes. This was actually from something that was a webinar that Harvard Medical School did about a couple of weeks ago. And Tanner Wiles watched that, and that was the whole impetus for tonight's program. And we have two psychiatrists from Harvard, Dr. Brent Forrester and Dr. Chris Palmer, talking about their personal connection to this. I just want to run this and see if we get some reaction, and hopefully we can get some of the folks in the audience, as we call it, to participate. So let's see if we can share the screen appropriately. Okay, if we can get this the way we want, share. Okay, and here we go.
Clinical work in my career for quarter century has been in older adults. And I backed off from frontline inpatient work many years ago to doing outpatient work to now doing a ton of research and administrative work. And so my direct clinical interaction is so much less than it used to be. But my professional identity has always been as a physician educator first and a researcher administrator second and third. But during the pandemic, I felt such a pull and frankly a guilt about not being in the hospital every day with my colleagues on our inpatient unit, where we suffered an awful outbreak of COVID-19 that decimated about half of our staff and a lot of patients. And although I was with them via telehealth and I would come in periodically, I wasn't there on the front lines and I felt awful. And then I realized in talking to a lot of people that what I was doing as division chief and trying to be a leader was critically important. But I really felt like that direct patient care is really what I needed to be doing. And I don't know where that comes from for me, 100%. And I know for all of it, we have our own sources of why we have this exaggerated sense of guilt in terms of being healthcare professionals. I think the first thing to do is just to be aware of it and not let it eat at you and to talk about it and to just share your feelings and your stories with other people. That is, I think, just so important. The second part of it, Chris, you were alluding to this stuff about, comparing yourself to other people and productivity. Social media is problematic in this way. And you got to be careful. When you see somebody posting something online about all the stuff that they're doing, you have no idea what the reality is. You really have no idea. It may look good, but, how many people are truly honest on social media about how their life is right now? It's not really what you see is not what you get. So try not to use that as a benchmark of comparing yourself to other people. That's a dangerous slope to go down it's hard to resist, but it is dangerous. And I think if you could just take a step back and not worry about what others are doing and worry about what you're doing, set your own personal goals, whatever they may be. what you're eating, what you're exercising, how much you're sleeping, how much time away from work you're taking. Set your own goals like you would when there's no pandemic and stick to them. And I think that's probably the best thing you can do. Do not compare yourself to other people. There's nothing good that comes out of that.
Yeah, no, I completely agree. In a way, I want to just augment that a little bit, because I think you're absolutely right. No two people are the same. And so if you're seeing a friend joining an online competition on social media and you're feeling like, oh, I should be doing that too. I think not comparing yourself to other people, trying to get over the guilt is important, but I think the pragmatic, concrete, like, well, how do I do that? How do I get over that guilt? How do I stop? I think that's like the $1 million question. So I'm going to attempt with a couple more maybe tips or thoughts that might be helpful, but it's really the $1 million question. Like, the world would be a happier place if somebody had the magical answer to that for every human being on the planet. But in my mind, I do think that one of the biggest things is it's about acceptance and self-compassion. And acceptance is acceptance of who you are and the life that you've got and the responsibilities that you've got. And so if you're a parent to young kids, if you're helping out your elderly parents, if you don't have nearly as much money as your friends who are online going around doing all these races or whatever and have nice bicycles and they're cycling everywhere, or taking nice vacations or doing whatever, everybody is different. And we all have different resources. We all have different strengths. But we're also different in the lives that we have led, the genes that we were born with, the upbringing that we had with all its strengths and all its shortcomings. And everybody's different. And if you've had a lot of adversity in your life, and then you're stressed on top of it, guess what? That you more than others are going to be pushed toward depression, toward post-traumatic stress disorder, toward anxiety, toward insomnia, through no fault of your own, simply because you had a rough life and somebody else didn't. And it can be easy to compare yourself and see what a loser I am, that they're doing everything and I should have enough time, or I should have the motivation, or I should have the energy to do that, but I just don't. I come home, I'm exhausted, I want to hide. I want to curl up in a ball on the couch and watch Netflix and eat and then go to bed. And I can't even pull it together to take a walk. I can't pull it together to do anything. And I think for those people, you need to practice some self-compassion, to just try to understand, how is it that I got to this place? Don't become hopeless and think you're trapped in that place, because you don't have to be. As a psychiatrist, I'm the first to say, there's hope for you. You can get out of that. But until you do get out of that, until you do the work and go through the process to get out of that, like, be compassionate, be nice to yourself. And because beating yourself up with guilt, with feelings of inferiority, is only going to make your depression and PTSD and anxiety worse. And then you're just really stuck in a vicious cycle that you're never going to get out of.
Yeah.
Okay, so an interesting discussion. Abbey, Shawn, what do you make of that?
Well, I think that's the bottom line is that you have to, practice self-compassion, and people don't do that. And, you should find some joy in your life every day, whether or not it's eating, a little tidbit of your favorite food, or, your guilty pleasure, or whatever's on television or whatever else, but you should have a little respite every day. For me, I think it's talking, and I just became a grandfather, so I've got some other nice things in my life. So 2020 wasn't all terrible life, a terrible year for me. So we have Shad in the audience. He's one of the medical students. This is his second year. So I was curious to see what he thinks in terms of, stress and COVID. So maybe you can unmic yourself and tell us, from your perspective as a student, how this looks to you.
Yeah, I mean, a lot of the same concerns that have already kind of been mentioned, but I think the biggest thing for us is just that there seems to be no end in sight, you know, and so it can be challenging endurance wise and things like that. But I think a lot of us are really missing kind of that social aspect of things, because we're a pretty small class, like 60 students, and we're a tight-knit crew. And so it's been challenging not to be able to see our, I guess we can call them our peers on a daily basis, you know, because that kind of being able to relate with one another and just those side conversations in between classes and things like that, that actually really goes a long way. And so I think that's been the most difficult part for us. That's why I think things like this are good, you know, even though they're virtual. I think it gives people a great opportunity to come together and connect. And you know, our class has been trying to do that a little bit as well. So yeah, those are just some of my thoughts, I guess, from my perspective as a medical student right now.
Shat, how have you personally been able to cope with this? Any techniques that you might recommend that have worked for you?
Yeah, I'm in a little bit more of a unique situation. I'm married. I have a 1-year-old daughter. So it has been a great opportunity for me to spend a lot more time at home and be able to, you know, see my daughter kind of growing up right before my eyes. I mean, she's only 1 year old, but I mean, in the last couple months, she's started walking, she started talking, you know, and I think our connection, our relationship has just grown a lot, and it's been helpful for my wife as well. I mean, definitely a little bit distracting, you know, trying to study in the midst of all that, but I am grateful for that opportunity to be able to spend a little bit more time with my family. And so again, I think you know, you see how important those kind of social networks are. At least that's what I've experienced.
Thank you so much for sharing. If anyone else would like to share or comment, Mindy, we probably can unmute everyone so that they could just jump in.
I think they can unmute themselves, so that works okay.
Oh, okay, that will work as well.
I did not mute everyone, so they can unmute themselves.
Okay, anyone who wants to jump in, feel free to do that. One of the other points that comes up frequently, and as we've kind of alluded to before, in the pandemic situation, there's a lot of stresses. There's this uncertainty, which leads to fear and anxiety and all kinds of other things. So how normal are some of these burnout reactions? Isn't that kind of like expected of a normal person to react this way?
That's an excellent
existential spin on this.
No, that's an excellent question. And, you know, it's fun to get into the existentialistic material inside of this. I have restructured my way of thinking about it with patients as shifting from an acute situation to the potential of a chronic situation. And when I look at it as chronic, let me say it this way. When it first started, I think a lot of people thought this would last a few months, but now we don't know. So it's a difference between acute anxiety and chronic anxiety, acute pain and chronic pain. And it's much harder to tell somebody, you know, and I know, Shawn, you do this all the time.
Sorry. Lost Abbey.
Okay. It'll probably be back in a moment, but Shawn, can you pick up on that concept?
I'm not exactly sure what I'm supposed to be doing, but what I would say is, you know, it'd be interesting to hear from other perspectives. So Dr. Fahmy, he's been very instrumental in the hospital and transition, and so now that he's, you know, head of medical staff, be interesting to see what perspective someone who has to actually look after several hundred people has to deal with, because, you have, the issues of surgeons not being able to get their surgeries done because their incomes are going down. At the same time, you got employed staff are worried about, shifts and PPE and all that stuff. So number one is, how do you deal with all that and deal with their stresses? And then how do you deal with your own stresses?
Yeah, so there's no doubt 2020 has been a very challenging year. I took over as chief medical officer of the hospital, and right before the pandemic hit, a couple of weeks before. And you can imagine there was a lot of anxiety in the hospital, and I'm the kind of person who internalizes a lot of that stuff and tries to see everything from another person's eyes. And the anxiety related to the nurses exposing themselves to risk, being on the front lines, the physicians, the hospitalists and intensivists who are primarily caring for these COVID patients. And I think that not only did I have to deal with my own set of anxieties related to me and taking something home to my family, but having to protect everybody at the hospital, I think added a lot of extra stress to the job. And it was a job where I was adjusting to. I've been an informatics guy in the IT world and trying to, and came up in that space. And it wasn't until this year that I, stepped forward and took on bigger responsibilities with the medical staff. I'm also the associate dean for GME at the hospital, so I oversee the medical students and the residents and their work at the hospital. So, in terms of the questions that came about, do I test this person? Do I take them out of isolation? Do I keep them in the hospital or discharge them? A lot of that we had to develop policies and procedures for, and it wasn't easy because we didn't have very much information. And every time you make a decision, you're questioning yourself whether you're putting somebody else at risk. I've never truly been an administrator. I've been seeing patients up until December, and since December, I haven't seen a patient. It's the first time in my life that I feel, I sense the other side, the administrative side of, and the stress and pressure that goes along with that. And it is different. It's a different kind of pressure. I think there's no doubt the physicians and the nurses that are in the rooms caring for these patients, putting in, donning and doffing PPE, are the ones that have to bear the brunt of it. But I'll tell you, when you're overseeing a COVID unit and we have 80 patients in the hospital, and you're the ones that's making these calls to families with end of life discussions and decisions, it wears on you. And it's been a challenging year. And I, when we're watching the video and you say somebody wants to come home, curl up on the couch, watch Netflix and not be bothered, there was many weeks like that throughout this year. And it's slowly we're adjusting and getting better, but it's hard to find the energy to get up and exercise. Even though I know it's good for me, it's hard to get the energy to I have young kids, 8 and 10, take the kids out and do something with them. Everything's been closed, right? No movies, no bowling alleys. So it's been hard to find that outlet and the relief, even on the limited time that you have away from the hospital. So, sessions like this help quite a bit. Hearing it from other people's perspective and hearing, everything from a student perspective to practicing outpatient physicians, I think it does give you that feeling like you're not going through it alone. And one of the reasons I joined today is because I wanted to hear those perspectives. I know that I have hospitalists and intensivists in the hospital that are burning out. I can feel it. I can feel it in the conversations with them. And I want to be able to provide them some sort of support or some sort of pathway to share that. And it's a hard thing to talk about in the hospital in a normal clinical setting. I think this kind of setting really helps us get the right word out that we're not alone dealing with this. So thank you all for hosting it. This was great.
Well, thanks so much, Sammy, for sharing. But let me ask you though, in your role in an administrative perspective, what have you done? What do you plan on doing? Anything specific in that arena?
So just last week, I was on a call with the FAU group that is focused on burnout and resident wellness in general. And we've, from the resident perspective, our ideas were to put a survey in their regular evaluation tool. They use MedHub to do rotation evaluations about colleagues and about the rotation and attendings. And the idea was put a quarterly survey in there, survey people for signs of burnout, and be able to offer them the employee assistance programs that we have for them to go and get some counseling. or be able to sit them down with the program director and review why they're having burnout, whether it's too heavy a call schedule or the types of patients they're seeing, types of rotations they're doing. So that conversation is ongoing. From the hospital side, we have a resiliency program led by our inpatient psychiatrist, Dr. Gershman, and another physician from Baptist Health that is typically focused on palliative care, but is very interested in wellness. And we've been able to do Zoom sessions with some of the medical staff members and hear them out and again, tell them that they're not alone, and offer these resiliency groups and meetings to share experiences and really be in it together as a medical staff.
Great. Thanks for sharing that information with us. I think that's very important, again, to feel that we're not in this alone.
Resilience is kind of an interesting thing because, you know, when I was asked by Tena to start thinking about this wellness committee, is the first thing I told her is this is not going to become the yoga granola committee. And then if you just do yoga and granola, then all your problems will go away. But at the same time, I think that there is something to say for, you know, self-care and you know, exercise and things like that. But doctors are a funny group of people. And, you know, in the same respect, I think that we're generally a fairly resilient bunch of people if you put us up against anybody else, because this is a group of people that's willing to give up their entire 20s in order to have a profession of helping people. And, you know, going through all the hoops and missing the parties in college and all the fun stuff that you miss in order to get your education and get those grades and be competitive to get into medical school and do stuff is pretty cool. But on the second part of it is that, let's say that now you get in the real world, and in the real world, everything's a little different. Like, so you passed every single hurdle. Every hurdle that you were ever given, you did it. Be good in college. Okay. Be good in medical school. Get a fellowship. You know, get a residency. You know, get a practice. You know, do all these things. And every single one of these milestones that could trip anybody up, you've done every single one of them. And then you get to the point where you get some moron on the telephone at the pharmacy that's basically telling you that you can't have $3 medication, you know, because they know better, you know, based on that algorithm, and it blows people's minds. They just can't deal with it. Or, you know, we're not, you know, going to authorize this or pay for that. And it's so obvious that this needs to be done because this is how you do it. And then you hit those obstructions, and sometimes you can't pass those obstructions. It sometimes just blows people's minds away, you know, because they can't, you know, necessarily move the earth like they normally do.
Or is it just another level that we have to develop some additional resilience to be able to make it through that plane?
Possibly, you know, but we're not prepared for that, you know, because you always succeed at everything you do, and now you hit a block wall of this monolithic wall that you know, basically is designed there to slow you down.
But on that note, you know, we've suggested that certainly as physicians, we've conquered a lot of hurdles, and we're a very resilient group. So some have suggested we should be able to handle these stresses, the stresses of COVID. Why are we complaining?
Well, because again, I think the system is stacked against us, and somewhat on purpose. That again, you have to sometimes choose between your ass and your patients. You know, how am I going to deal with this? You know, am I financially going to take the hit? MIPS and macros is a perfect example of that. You know, good intentions gone bad. Let's say you have a 300-pound diabetic who refuses to watch their weight, watch their sugar, you know, take their medicines. Well, now you're getting graded on that. And let's say that they don't get their A1C down. Let's say they don't do these milestones. That goes against your record. So what do? You could be compassionate and say, well, they're doing the best they can. Or you could say, let's fire the guy and get him off my panel so that I have better numbers. You know, and some people game the system like that. And some people will just say, look, I'm going to take the hit because, you know, this guy's just capable of doing what he's doing. It's better for me to help him somewhat than him to have no help at all and get help from the ER. Because that's essentially what happens. These patients, they become medical lepers and they end up getting all the care in the ER, you know, because they're going to mess up the ACO's numbers.
There's a lot of stress-inducing episodes, scenarios that we really didn't receive training for in medical school on how to.
Right. And again, it puts you between yourself and them.
So we have, I think, a question in the chat, or perhaps a comment about Dr. Gonzalez with TrustBridge might have an interesting idea. So Faustino, if you're there, I see your name and you can unmute yourself. Can you share with us your interesting thought?
I am. I'm in a somewhat unique situation. As a hospice and palliative medicine physician, I spend a lot of time dealing with adversity. I trained, I'm a general internist by training, and I trained in the early days of the AIDS crisis when we were losing 12, 13, 14 patients a day, many of them the same age as me, as us, in their 20s. And I guess over time, we learned to cope. In my current situation, I'm part of a physician group. We're almost 30 doctors. And what we have learned to do is talk to each other. We have regular meetings. We usually every other Thursday after 5:30, I get everybody together and we express our concerns. And that has been very, very helpful. I happen to work for a company, an institution that has been very generous, and we have enough PPE to last 8 months. So some of the things that have been issues for other clinicians have not been an issue for us. I did catch COVID, not from a patient, but because I was not careful. And that was a very sobering experience because I ended up giving it to my wife, who's also an internist, and to one of my adult children. And that, talking about guilt, that was my sense of guilt, even though they both did very well. We all did. But the idea of me being a vector, and I don't practice, I manage a large physician group. And sometimes I wish that I could be there taking care of patients. And there's that thing that we as doctors have, that we should be in the front lines. And that has caused, I guess, a little bit of guilt. I acknowledge that. But as I said, I have a group of colleagues and a support system that allow us all to vent and to express our anger and uncertainty. Every day something new happens, and we make rules and guidelines and plans, and then 2 days later everything changes, and that's a bit disconcerting. But for the most part, we have found ways to cope, and I think that's the most important thing: talking and acknowledging that this sucks, and that we were not prepared for this. And moments like this, you're allowing me to just talk, and that has helped me and has helped a lot of the doctors in my group to get past this, and always being the optimist, right? We're gonna get through this eventually, and we're gonna figure it out. And it's that optimism that keeps us going and hoping that that things will one day improve.
Thanks so much for sharing. You know, the comment you make is exactly what those fellows from Harvard were saying about the guilt we feel if we're not on the front lines. And I know personally, I felt that way also. Like, gee, you know, you see all these stories and hear all these people talking. I'd like to be there on the front lines. But as they made the point, so you're involved in a lot of administrative things. I'm involved in doing a lot of webinars, education. We're doing our part. So it doesn't necessarily mean that we need to feel guilty for not actually inserting the ventilators and that type of stuff. But very, very, very well put.
Valerie, you have some comments?
Yeah, a couple of comments.
Please.
I found it extremely helpful from the very beginning to come and do telepsychiatry from my office. and not from home. And surprisingly, the patients were very, very reassured that when they saw my office in the background and they said, "You're in your office?" And I said, "Well, of course I'm in my office, because if I was at home, I'd be standing in front of the fridge wondering what else could I eat." And they said, "Me too." And then we talk about, what's your trigger foods and control and taking care of yourself. And it would feed into all sorts of different things. But I found it interesting that patients were reassured to see my office. It made it more normal.
So back to that, having a routine type thing.
Yeah.
It doesn't have to be an exercise routine.
The other thing I have a question about, something that made me really pissed off, and I'm still wondering if it was, if I was overreacting or not. I go to some ALFs and do psych there. And this one ALF was not practicing social distancing or wearing masks and still having patients, eat together in the dining room. And when I spoke to the administrator, he was like, "Well, we don't have any cases, so I don't see why we have to do that." And I'm like, "Yeah, but when you get a case, and you will get a case, it's going to go through here like wildfire." And so I was there one day in June, and they told me that they were testing the patients for the first time for COVID. And about 2 weeks later, I get this call from my patient, one of my patients there, about something else. And she mentioned in passing that they had a lot of positive COVID patients. I said, "Oh, really?" So I called up the nurse. I said, "Was any of the 15 patients that I saw, were any of mine positive?" And it turns out that 8 were positive and 3 of them were already dead. And I said, "What happened to contact tracing? When were you going to tell me about this? Because I should have been isolating." And I mean, of course, I was totally, I go in there with a lab coat and an N95 mask and a face shield and gloves, the whole 9 yards. But, I was pretty pissed that they never told me.
And rightly so. But while you're making some comments there, Valerie, psychiatry and counseling it would seem on the surface to lend itself much better to telemedicine than a lot of other specialties. But is there a big difference between 2-dimensional counseling and in the room 3-dimensional?
I found that you can't do telemedicine with demented patients. They don't understand that there's a person on the other, in that picture, that it's a real person. They push it away, even if there's a nurse there with them, holding the phone or whatever, it's impossible. You have to go see them. The other thing, what did I want to say?
Well, Valerie, while you're thinking, I just want to let you know that
on the line here, right? We got you on the audio landline, no doubt, right? Okay.
Old fashioned, yeah. But Valerie and I have talked about this as well, that it's very frustrating for people in mental health, because we do need sometimes to sit in the same room. And sometimes the older folks, they will look at it and say, "What's this television set? What does that mean?" And it's very frustrating. And she speaks to a lot of the issues, because a lot of the services that she has to administer have been restricted. And some of these patients have not seen their counselors or whomever in a very long time, and things fall apart. And that's a drain on the mental health folks, because they will get back to feeling guilty. You can't do your work. It's not your fault. But that's another issue, and I think it's healthy to talk about it. So, Valerie, did I trigger your thoughts?
Well, not being allowed to go to certain facilities because they weren't letting anyone in, and having people on, medications that should be monitored pretty closely and not being able to do so is pretty frustrating.
So clearly, there's a difference between the 2-dimensional contact and being able to exchange energy.
Well, it sounds like one of the big frustrations is also dealing with people who don't get it. So if you have an institution that gets it, it's a lot easier than having a different situation. Now, I work in my office, so I mean, that's 95% of what I do. So I have control over my environment. So if someone came through the office and had COVID, I should be aware and be able to tell the staff or has been exposed, et cetera. But, you know, if you're in a place where they're kind of hiding everything, I can imagine that's very scary and at the same time very upsetting.
No question about
Shawn, I have a question really quickly, and maybe other people as well. You know, we are physicians. We are supposed to be the practitioners of medicine, of safety, of prudence. And when the media has these meetings where people are not wearing the mask and defying the mask, what effect does that have on you or other doctors that you know that we're trying so hard to put a cap on this thing, and there's such a large group of people who are mocking it? It must be unnerving. It is for me. I find it intolerable. Your thoughts on that? Well,
I think the bottom line is that you can try to change the world, or you can change the world around you. And a perfect example is there was a video recently of this lady who goes to the Home Depot, or actually the Office Depot. She's wearing a mask. It turns out this lady had a kidney transplant. She's on immune suppressive drugs. She's scared crapless, and she went to the store. And then there's a young lady who's not wearing a mask, and the patient decides to confront her, and nothing good happens of this. The young lady pushes her on the floor. The lady breaks her hip. Okay, so that's like the do not example. You're not going to make somebody who's crazy, behave. The only thing you can do is, work on your envelope. So I tell my older patients, my patients are very old, do you really know what your grandkids are doing? Because I've seen a couple of my patients get killed by their grandkids because they're out there being irresponsible. So all you can do is take care of your envelope, and you've got to keep, your patients, because this is kind of a test of Darwinism to a certain extent. The young and dumb are going to get killed off, or at least, they're going to, and they're going to take other people with them, if people aren't, protecting themselves. And they also have to, look at it in terms of, you have to be somewhat suspicious, unfortunately, and you have to keep your envelope very small.
So clearly there's a lot of issues out here, and I think this evening we've had the opportunity just to begin to peek into them. So I thank everyone for being so candid and sharing their perspectives. Shawn and Abbey, any closing comments on what we can do to turn things around in the middle of this pandemic that we don't know when it's going to end?
Well, what I've taken from today is just to take care of yourself. Give yourself a break. Yes. Don't abuse yourself, and look at the resources online. We have a lot of resources online that might help you with certain things. I mean, they're not going to help with everything, but definitely in terms of the financial stuff, especially if you run your own practice, there's some stuff that we can do to help. And we're always available, if you want to call or whatever, and if, we don't have the answer, we can probably find somebody who may.
I so agree. Let's not do it alone. We need structure, we need people, we need activity, we need purpose, whatever it is. We will get through this. We will get through this.
Friday morning phone calls.
Say that again?
We need Friday morning phone calls.
Friday morning phone calls. I know what she's referring to, but we have a group that meets and we talk about this every Friday morning. The frustrations and the this and that. And it's like a glass of water when you're thirsty. That's what we need. We can't do it alone. Shawn, I agree with you 100%. And Valerie, 150%.
Which all the more reason we should have more Thursday evening Zoom calls on this topic. Our guests and participants are agreeable. We will definitely continue this discussion down the road. So I thank everyone for being part of this evening. I want to remind you, coming up in the next week is the beginning of our Future of Medicine series. Usually that's done live and in person. This year, obviously, that's not going to be the case, but we're going to take it virtually. The first session is going to be once a week for about 6 weeks, different topics. The first one's coming up next Thursday, October 1st, 6 to 7:30, the same time that we're doing this right now. The topic of our first Future Medicine session is Critical Role of Healthcare During COVID-19. And they'll be featuring, the speakers are Susan Bailey, Dr. Susan Bailey, who's president of the American Medical Association, and Dr. Michael Patet, who's the president of the FMA. They wrote down AMA on this thing here, but we know he's president of the FMA. So that'll be coming up next week. Look for that, register for that. There's no charge. It's a CME course. And we'd love to have everyone a part of that. So once again, thank you everyone for being here this evening.
Just one comment. I mean, this speaks to the our particular medical society. A lot of people may not know this, but Palm Beach County Medical Society is considered one of the premier county medical societies in the entire country. To get the president of the AMA to come down consistently, and every time we have our meetings, whether it's the gala or the Future of Medicine, we always have representation from the AMA, and generally the president will grace us with their presence. I mean, most years we have that, and that's only because of the fact that we're so successful. We have something like 1,200 to 1,500 members out of 3,000. So that's unprecedented to have 50% of your physician members in one particular area. Dade County only has 1 out of 5, and that is one of the reasons why we're so strong. And so and that's partly because everybody here gets it and participates. So participation is very useful. And if you're not a member, please become one, because you'll get a lot out of your membership. And also all of these CMEs and stuff are very helpful. You always pick up something interesting. And again, it helps with that burnout, participating, having things to do, networking is all very important.
Thank you, Shawn, for those important words and a great pat in the back for our medical society, which does a terrific job. And you're right, we are considered pretty high on a national basis when they talk about Palm Beach County Medical Society. We do things that some state medical societies haven't even gotten around to doing yet. So it's a great thing. We encourage everybody to continue to participate in our programs as well. So good evening to everyone. We'll see you next time. As they say all the time, stay safe. And we'll be saying that for a while, but certainly continue to do that. We'll see you soon.
Thank you, everyone.
Take care.
Bye-bye.